In the United States, sometimes patients don't see an OB-GYN for essentially a referral for a mammogram. There are many places in this country where if you want to get a routine screening mammogram, you don't need a doctor's order. You can walk in and have it done. Now, if you're called back for a finding, then you would need a doctor's order for a diagnostic mammogram and possible ultrasound. There are a lot of patients who do see an OB-GYN for breast, whether it's an annual exam, whether the OB-GYN is like, oh, you're overdoing your mammogram, we need to get you in. But there are a lot of primary care providers too in this country that manage the same thing as OB-GYN. It really does come down to, and although it does take more time, I do feel that we as breast specialists are equipped with that knowledge. We need to spend time with our referring providers. If we can equip them with the knowledge, they can equip their patients with the knowledge. I am very blessed to have a really amazing referral base where they are constantly asking me questions. They're constantly allowing me to come in during their, monthly meeting to talk about any updates or anything they need to notify their patients of. I constantly have our OB-GYNs calling me, asking me, what do I tell the patient about X, Y, or Z? But that is a rare situation. Many patients, unfortunately, face kind of what you did in that regard of where there's just a complete lack of education and a complete disconnect. To me, the only way we're going to rectify this is as the ones who are the gatekeepers in a sense of breast cancer detection, breast cancer treatment, whether you're a breast radiologist, a surgeon, a breast oncologist, we really need to take it upon ourselves as a community to extend that olive branch to our colleagues in primary care, OB, to really educate them to help our patients, because their patients ultimately are our patients. So collectively, we need to be working together so that patients don't go through a horrible experience where they're not, aware of, oh, I did not realize that, I'm supposed to be doing a self-breast exam monthly, 7 to 10 days after my menstrual cycle, and how to properly do an exam. I spend a lot of time with patients showing them, how do you do a proper self-breast exam? When do you do it? Because, just because you are going in for your annual mammogram, something may pop up in the interim where you could feel it. Or alternatively, you may be doing those self-breast exams monthly, but there might be something growing that you can't feel yet. And so that's why going in for your mammogram is just as important as the self-breast exam. So again, I think it's just going to come down to education, and we as a breast cancer community are going to have to push a little harder, I feel, with our referring providers to educate them so that they can accurately educate their patients.